How do opioids cause addiction? Opioid use, even short-term, can lead to addiction and, too often, overdose. Opioids are addictive because they activate powerful reward centers in your brain. Opioids bind to opioid receptors in the central nervous system in order to block pain, but also trigger the release of endorphins, your brain's feel-good neurotransmitters. Endorphins muffle your perception of pain and boost feelings of pleasure, creating a temporary but powerful sense of well-being. The information provided in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Here is a list of the most commonly abused opiates: heroin, morphine, codeine, fentanyl, meperidine, oxycodone, hydrocodone, hydromorphone, and oxymorphone. They are available in various formulations. Some are legal, but some are illegal, such as heroin. Some occur naturally, while others are synthetic or semi-synthetic. When you take opioids repeatedly over time, your body slows its production of endorphins. The same dose of opioids stops triggering such a strong flood of good feelings. This is called tolerance. One reason opioid addiction is so common is that people who develop tolerance may feel driven to increase their doses so they can keep feeling good. Opioids are most addictive when you take them using methods different from what was prescribed, such as crushing a pill so that it can be snorted or injected. This life-threatening practice is even more dangerous if the pill is a long or extended acting formulation. Rapidly delivering all the medicine to your body can cause an accidental overdose. Taking more than your prescribed dose of opioid medication, or more often than prescribed, also increases your risk of addiction. The length of time you use prescribed opioids also plays a role. Researchers have found that taking opioid medications for more than a few days increases your risk of long-term use, which increases your risk of addiction. The odds you'll still be on opioids after a year after starting a short course increase after only 5 days on opioids. Opioids also affect other parts of your brain and body, such as the brainstem, which controls your breathing and heart rate, and the spinal cord, which transmits pain signals from your body to your brain. Opioids can cause side effects such as drowsiness, nausea, constipation, and respiratory depression. Opioids can also interact with other drugs or alcohol, increasing the risk of overdose and death. Several additional factors, such as genetic, psychological, and environmental, play a role in addiction, which can happen quickly or after many years of opioid use. There are many known risk factors of opioid misuse and addiction that are listed here. Some include poverty, family history of substance abuse, personal history, criminal activity, mental disorder, tobacco use, prior drug or alcohol rehabilitation, amongst others. Opioids are safest when used for 3 or fewer days to manage acute pain, such as pain that follows surgery or a bone fracture. If you need opioids for acute pain, work with your doctor to take the lowest dose possible for the shortest time needed, exactly as prescribed. If you're living with chronic pain, opioids are not likely to be a safe and effective long-term treatment option. Many other treatments are available, including less addictive pain medications and non-pharmacological therapies. Aim for a treatment plan that makes it possible to enjoy your life without opioids if possible. Help prevent addiction in your family and community by safeguarding opioid medications while you use them and disposing of unused opioids properly. If you or someone you know is struggling with opioid addiction, please seek professional help. There are effective treatments available, such as medication-assisted therapy with products such as methadone, buprenorphine, naltrexone, lofexidine. Behavioral therapies include cognitive behavioral therapy, contingency management, motivational enhancement therapy, family or peer support groups. Because addiction can affect so many aspects of a person's life, treatment should address the needs of the whole person to be successful. Counselors may select from a menu of services that meet the specific medical, mental, social, occupational, family, and legal needs of their patients to help in their recovery. You are not alone in this fight. There is hope, and recovery is possible. Thank you for watching this video. Please remember to subscribe, like, and share. Thank you.